Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker. Prostate cancer is a very important topic for men across the country to be aware of, and joining us to discuss both symptoms and prevention is Massimiliano Spaliviero, a urologic oncologist with Stony Brook Urology and the Stony Brook Cancer Center. Thank you for joining us.
Good afternoon. Thank you for the kind invitation.
Certainly. So, Doctor, why don't we start with kind of the basics? Can you explain what prostate cancer is and who truly is most affected?
Yeah, so prostate cancer is one of the most common internal malignancies in the United States males, and approximately 12% of the American men will be diagnosed with prostate cancer in their lifetime. Prostate cancer is the second leading cause of cancer-related death in the United States men. However, the approximate lifetime risk of dying from prostate cancer is about 3%. And this includes men of all ancestries and heritage, including the African ancestry, where the risk is approximately 6%. It is a tumor that originates from the epithelial cells of the prostate. The epithelial cells are the cells that line body cavities and cover most body organs and surface.
It seems, again, super basic, but I mean, what is the actual function of the prostate? I'm sure there's plenty of men out there that have no idea. They know they have one, but what does it do?
So the prostate is a gland, which is an organ that makes a fluid or a secretion. And specifically, the prostate makes the most part of the semen. So the sperm is produced by the testicles, whereas the semen is mostly produced by the prostate, and then the two of them converge together.
And so what are sort of the factors that lead to prostate cancer? Again, are they environmental? Does it have to do with diet? Is it genetic? What leads to cancer?
There is a little bit of both, actually, because it could be related to smoking, so cigarette smoking. It could be related to obesity. It could be related to environmental exposures. Not all of them are known to us at this point. There is also some genetic predisposition in the sense that if a patient has a family member, namely a father or a brother or more than one first degree relatives with prostate cancer, will not get prostate cancer for sure, but is at a little bit higher risk of developing prostate cancer in their lifetime.
With prostate cancer, is it something that is routinely checked for? And as a female, I don't know, I'm assuming it is. But when people are diagnosed, I mean, how quickly are they being diagnosed? Is it more like a stage 1, or by the time they find it, are you already in the advanced stages? And what type of symptoms can people be considering? So if they feel something like that, they can get themselves in to be checked out.
First of all, the men that are more at risk of developing prostate cancer are around the age of 65. Prostate cancer doesn't give any major symptoms. Only when there is an advanced cancer that can block the urination or can involve the lining of the prostate or can be spreading to the bone, then people will manifest like urinary symptoms or blood in the urine or bone pain. We screen patients that are not symptomatic, and that most of the times is able to allow us to make a diagnosis if needed when the patients are still at stage 1. And so when the disease is still curable.
When should screening start? I mean, you said 65 tends to be when the cancer strikes, but I mean, I'm 43. Should I be getting screened, or I don't have to really worry about it just yet?
So at the age of 43, there is no strong recommendation for the screening of prostate cancer. The new American Urological Association guidelines about the early screening of prostate cancer came out this year in May of 2023. The current recommendation include that in male between the age of 45 and 50 is not mandatory, but a gentleman may want to have the prostate checked and have a baseline blood test to see whether there is any concern in terms of the level of the blood test. Men between the age of 45 and 50 should be checked in case they have some of the risk factors, like we were discussing, if somebody is of African ancestry, if there is any mutation that occurred in one of the family members that developed some other cancer, or if there is a strong family history. So somebody that has either the father or the brother with prostate cancer, or two males in the family that had the prostate cancer before the age of 60, or they died of disease. The group where the screening is the most valuable is between the age of 50 and 69 years of age. The screening is now recommended to be performed every 2 to 4 years. However, depending on the patient preference, the age, the level of the blood test, PSA, the risk of prostate cancer because of the factors that we just discussed, the life expectancy, how long the man is expected to live, and general decision between the physician and the patient, that can be done a little bit more often or a little bit less often.
Some of the symptoms that you were talking about seem like maybe men could mistake for kidney stones versus it being a prostate problem, things like blood in the urine or flow. And is that something that is often confused?
Not often, meaning
Not often.
The symptoms that you described, typically take a patient to the urologist. So if somebody has difficulties urinating or blood in the urine or pain, they come to the urologist. Once we see that they are within the age where the screening is recommended, we offer the screening to the patient.
Got it.
Another way also is that the primary care physicians are very aware of the prostate cancer screening, so they might get the blood test, do the physical exam in their office, and then refer the patient to us if there is any concern.
And you mentioned that the mortality rate is actually pretty low. I think you said around 3%, which is good. So how is it treated? What are the treatment options if, say, cancer is diagnosed?
Sure. If a cancer is diagnosed, and typically is diagnosed with a prostate biopsy, the first step that we do is do a proper risk stratification of the patient, because depending on the findings under the microscope and the imaging that we obtain to make the diagnosis, the cancer may be divided into very low risk or low risk, intermediate risk, high risk, or very high risk. And depending on the category and depending on the life expectancy, how long the patient is expected to live based on other medical condition or their health status, then there are different recommendations. We can go anywhere from the active surveillance, which is when we don't take any active treatment, but we monitor to make sure that the cancer doesn't become more aggressive and more prevalent inside the prostate, to the surgical removal, where we do a prostatectomy, the removal of the prostate, nowadays mostly performed with laparoscopy and with a robotic approach. Some patients choose radiation, which can come in the form of CyberKnife versus the conventional radiation treatment, or the brachytherapy, what it was used to be called the seeds in the prostate. Or there are people that can do medical management, so only receiving medicines if any of the above mentioned treatments would be too much or not indicated based on their conditions, their life expectancy, and their preference.
Well, thank you so much, Dr. Massimiliano Spaliviero, for being on the program and really shedding light on prostate cancer. More men need to be aware of this so we can protect as many as possible, with 3% of Caucasians suffering from that and up to 6% in African Americans. Thank you again for taking time to explain this to our audience.
Important information, Doc. Thank you.
Thank you very much. It's been a pleasure being with you.
Well, that wraps up this segment. Make sure you stay tuned. We'll have more after the break. Don't be screwed by lesser spine institutes who bait you with minimally invasive procedures, then switch to screws, rods, disc replacements, and hardware. At Bonati, no metal hardware fusions are ever used. Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect 98.75% patient satisfaction. Over half our patients have suffered from failed back and neck surgeries at other facilities. Bonati succeeds where others fail. Michael is able to work and play his favorite sports again thanks to his exclusive Bonati Spine procedures.
For fun, I ride motorcycles. I played traveling softball with my church, and I owned a construction business. I done carpentry, sheetrock, pretty much anything dealing with a house.
That is until Michael was involved in a car accident, and over the next year and a half, he experienced ever-increasing pain.
And it started off as a little problem, but it escalated into a big problem. I started hurting more and more every day. I couldn't work, I couldn't bend over, I couldn't tie my shoes, I couldn't walk for long distance, I couldn't ride my motorcycle, I couldn't play no more softball. I couldn't hardly sleep. There'd be a lot of nights I'd be up all night.
Michael tried conservative treatments to relieve his pain.
I could take pain medication, but I never did get no relief. It would slow it down a little bit. I could still feel it. But so when it started wearing off, it would be to the point that I had to get in bed right then. I just couldn't take it anymore. And I have bought a massage chair and I tried to get in it, but man, it didn't do nothing. I never could get no relief. I mean, it was constant. It was day and night. It never stopped hurting. So I tried physical therapy. And some days, man, I barely could even walk out of that place. One day I was on the job, and I felt like I had a heart attack. My chest felt like it was going to bust. So I laid down in the van, and I come home down on Friday, and I told my wife, I said, I'm got a problem. I said, I don't know what it is. I said, I just need to go see my regular doctor and see if he can refer me to go see somebody.
His doctors recommended that he rest.
He said, well, get a bunch of rest. He said, well, just sit around. He said, but you need to do a little walking some days more. So I was just sitting in the chair. So I go back to physical therapy.
After a short period of time, his physical therapist told him he needed to seek a surgical alternative to eliminate his pain.
He said, this ain't gonna help you. He said, you need this problem fixed. So he referred me to go see a doctor in Pinehurst. Well, I go up there and they done an MRI and they seen a few things, but they never did address the problem. They wanted to talk to me besides fixing what I had going on. Then I got referred to go to Duke. They seen what I had going on, but they never did fix the problem. They said, well, let's wait. It'll heal up on its own. He said it might take another 2 years. I'm already been hurt a year and a half at this time.
Not wanting to just wait again and hope the pain would stop, Michael started researching for another opinion.
I went online and I researched. I said, I want the best spine center in the world. Duke come up was one of them, and the Bonati Spine Center. I contacted the Bonati Spine Center and I talked to Catania.
After speaking with the patient advocate, Michael sent in his MRIs for a review, and Dr. Bonati called him personally to discuss his case.
Before I could even tell him what kind of symptoms I had, he started telling me over the phone. I said, and all he's done is looked at me MRIs. I said, all these other people saying all this, but nobody's never even recommended us to do surgery. And he told me, said, if you come down here, he says, we can address them problems. He told me he would do a surgery in my thoracic spine. He says, and we can stop your chest pain.
After learning he was a candidate for the exclusive Bonati Spine procedures, Michael made the 8-hour drive from North Carolina to Hudson, Florida.
When I come in here that Monday morning, I felt bad, and I really did. I felt bad. I had a lot of pain in my leg, and it would radiate all the way down to my heel. In my chest, it felt like somebody had me in a clamp, just pressing on it, pressing, tightening it up. Well, they walked me over to another building. When I done them x-rays, they told me to come back over, that I was going to be able to see the surgeon. He's going to come in and go over everything with me. He showed me all the problems that I had. He said, well, you got a bulging disc there, and you got some material on your nerve. It felt wonderful for somebody to tell me that they could go ahead and do surgery the next morning with what they're already seen. Man, it felt wonderful. I was a happy man when they said, man, I can fix it.
At the Bonati Spine Institute, surgeries are performed incrementally using conscious IV sedation. This process keeps the patient awake and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
When I was on the operating table, the doctor, he said, Mike, he said, remove this last piece of material off your nerve. He said, how do your chest feel? I said, Doc, the pain's already gone. I felt it then that pain had already left me.
How you doing, Michael?
I'm doing good.
Okay, you're going to take this leg, keep it straight, lift it up off the bed. Whole leg. Pain in the calf?
No, sir.
Heel?
No, sir.
Hamstring?
No, sir. When I got in the recovery room, the lady said, Mike said, you feel any pain in your chest? I said, no, ma'am. I said, my pain is gone. I ain't felt this good in a year and a half. I done my surgery 3 days ago, and I've had no pain in my chest for 3 days. Before, that pain never stopped. It never stopped. It was night and day. It didn't, no matter what I'd done, it was there.
After the exclusive Bonati Spine procedures, patients are not required to wear uncomfortable braces or go through weeks of physical therapy. Instead, they are instructed to walk about 40 minutes a day.
They didn't tell me I needed no therapy. They just told me it was just going to be a healing process.
Michael highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
I'd recommend it to anybody. If they got back pain, chest pain, neck pain, need to come on down and let them fix that problem. If you had that problem for a long time, it needs to be addressed.
Now pain-free, Michael is looking forward to getting back to work and playing the sports he loves.
Man, I'm looking forward to going to work. I've been out of work a year and a half, and I'm the type of man, I like to work. I love to work. I love to work around my house. I love to ride motorcycles. And like I said, I played traveling softball.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Roku, Google Play, the Apple App Store, and Amazon Fire TV. Welcome back to American Medicine Today. In the early days of the COVID pandemic, many doctors were scorned for prescribing a decades-old Nobel Prize-winning medication called Ivermectin. And a new book is being called a scathing expose on the catastrophic impacts of mass media censorship and the relentless propaganda that led to one of the greatest humanitarian crises in history. Joining us to discuss is Dr. Pierre Kory, author of The War on Ivermectin, the medicine that saved millions and could have ended the pandemic. Thank you for joining us, Dr. Kory.
Thanks. Pleasure to be here.
Certainly. So why don't you take us back to those early days of the pandemic, and why was ivermectin really so vilified by the media?
One way I would answer that is, although my book is called The War on Ivermectin, one of my colleagues could have written the book The War on Hydroxychloroquine. It was literally the same war, same tactics, same results. So I think the suppression of early treatment started with hydroxychloroquine in 2020. Once the efficacy of ivermectin was known and started to circulate, they went really hard after ivermectin. Now, why would they do this? Let me count the ways. I mean, first of all, ivermectin and hydroxychloroquine threatened the massive global market for vaccines. It would have increased vaccine hesitancy because you would have had a safe alternative. It would have disallowed the EUA to be issued because you can't have an EUA for a vaccine if you have an effective treatment. And it also threatened the markets for all of the pricey patented pharmaceuticals like Paxlovid, Molnupiravir, Remdesivir, monoclonal antibodies. So I mean, literally threatened a market, if you look at globally, of well over $100 billion. And, this war that I describe in my book on ivermectin, that's a war that's been going on for decades. The pharmaceutical industry always attacks older, off-patent, safe drugs for the pricey new pharmaceuticals.
I understand that things are a business in an industry and, you have to make a profit. I get that. However, I mean, when human lives are at stake,
yes.
This applies to so many other drugs, not just specifically ivermectin and COVID and things like that, but I mean, diabetes drugs and the whole gamut that it runs. Why aren't there safeguards to prevent this sort of activity from these pharmaceutical companies? They need to make the right drugs at the right price that are the most effective available to the most people, yet they don't in the name of profits. Explain that to me.
Yep. Well, I will tell you, your kind of question was sort of how I started. How could this be possible? How could they do this and get away with it? And that, one of the many things that I've learned in COVID is studying the history of the pharmaceutical industry. You have to understand that is a criminal industry. They have caused massive losses of life with various products where they've suppressed the adverse effects in the past. If you know about anything about the Vioxx scandal, I mean, they knew it was causing heart attacks. It led to the death of about 60,000 Americans. One expert in the court case testified that it would be like 4 jumbo jetliners crashing every week for 5 years to lead to those kind of deaths. And what do? They pay fines and move on. They've been fined in the last 20 largest settlements. I think it's somewhere around $30 billion in civil and criminal penalties. I think 16 was in criminal. So that's part of their business. They are not a normal industry. They literally are criminal, and there's much evidence to show that they do not care about the loss of life. They put shareholder profits ahead of everything. And it's actually terrifying when you look at their behaviors over the last 20, 30 years.
I just don't understand how they can tell people that those drugs were ineffective when they're saving lives just to promote these other medications.
I never understood why because I used those two medications, I gave it to my family, and I gave it to my friends, and I gave it to anybody that was in a possibility to have a risk of this disease. When I went to the pharmacy to try to buy, being a doctor, they denied me to get the medication.
We're going to take a short break, but we'll continue our discussion with Dr. Pierre Kory after this. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati Spine procedures. Using his genius, Bonati invented the precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati Spine procedures, they consistently reflect 98.75% patient satisfaction. 75,000 procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Visit askbonati.com. Welcome back to American Medicine Today. We're continuing our discussion with special guest Pierre Kory, highlighting the use of ivermectin and how doctors were being villainized for using it. Is it they really felt these new medications they were making were ineffective, so the only way to get people to take them was to scare everyone off of those that would actually save lives?
I think that's part of it. I do think that it was the vaccines much more than the competing products, is that they wanted to promote and protect this global vaccination campaign. And you would have had massively reduced uptake of these vaccines had the knowledge of efficacy of ivermectin, not only in treatment, but in prevention. By the way, the data for ivermectin in preventing COVID is actually some of the strongest data we have. It's even stronger than in treatment. And so I think it was really the vaccines that it threatened, and that's why they attacked it. Just briefly, my book is really structured. It's part an autobiography of everything that I've learned and gone through in COVID, because I was very active on numerous aspects of COVID. But I really spell out and I detail how they attacked ivermectin using something called the disinformation playbook. That's from an article written in 2017 by the Union for Concerned Scientists, and it describes the long-standing tactics that pharmaceutical industry uses to either promote their drugs or to destroy adverse information on safer drugs. And And those tactics were pioneered by the tobacco industry in the 1950s. And they consist of making fraudulent trials, corralling the media, agencies, officials, and especially what they did here in COVID. I mean, they literally run the media now. They're such a massive advertiser that they literally can censor any sort of information that they want. And they censored aggressively at the level of media and medical journals all reports of the positive trials that were coming out around ivermectin. They only communicated negative trials. And those negative trials were actually fraudulent, done by pharmaceutical company conflicted investigators.
We do have a corrupted system that is not only the pharmacy or the pharmaceutical companies. I really think it's associated with people who benefit of this situation, and it's always leave on the obscurity. Politicians do that. They receive some type of a behavior where they get or shares or some kickbacks or something special for them that we don't never know. And we never make accountable these situations.
People who've read my book and with the reviews, they're all just shocked at the level of detail of this unholy alliance that he also referred to, which is at the level of the government, the agencies. I mean, the pharmaceutical industry has a tight grip and controls not only the federal agencies, but the medical journals and the professional societies. And that has to stop. And I think there are ways to do it. And I hope it happens.
Well, we love the fact that you kind of spearheaded, you co-founded the Frontline COVID-19 Critical Care Alliance, flccc.net, I believe. And yes. I followed that myself. So thank you very much for being a voice for the people and enduring unwarranted criticisms. Thank you, Dr. Pierre Kory, for being on the program.
Thank you.
Well, that's all we have for you on this episode of American Medicine Today. Join us again next time. Thank you for watching. If you have any comments or questions, contact us at the numbers below, or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. We would like to hear from you.